Subpoena? For what? Oh
no. All rise for the Honorable Judge Elise Jones. Court is now in session.
Please be seated. You may now present your case.
I would like to call my client to the bench so she can present her case.
Okay. I was in the hospital in the ICU for 4 weeks for septic shock and adult respiratory distress syndrome. After a while, I developed a bed sore on my tailbone, and it really hurt and it wasn't treated properly, and it was still there 3 months later.
The documentation also reads that you were sedated on the ventilator. Is this correct?
Yes.
Okay. You may sit down. Does the RN have anything to present in regard to this case?
Yes. When I saw that my patient had a pressure ulcer over her sacrum, I tried repeatedly that day to contact the doctor, and he did not answer me until the next day, and that's when I documented that he had called. I continued, of course, that day, the first day I saw the pressure ulcer, to turn her every 2 hours to take pressure off of her sacrum. The next day, the physician ordered a consult to the wound care nurse, and the wound care nurse did not see the patient until 3 days later. Of course, the other nurses are not on the floor. We turned the patient every 2 hours, and then when we got the wound care nurse's care plan, we implemented the things that she wanted us to do.
You may now sit down. Do you have all of the documentation to support this case?
I do, Your Honor. May I approach the bench?
You may.
After reviewing the client's chart, the record indicates no documentation of any interventions that would have prevented the pressure lesion from getting worse after its discovery. The physician should have been notified at once that a small skin tear had appeared on the tailbone of the client. Therefore, the only time the physician was noted was a day after the initial event. The physician ordered a wound care nurse and consult for a special bed, but the chart indicates that the wound care nurse did not arrive until 3 days after the start of the pressure ulcer. Therefore, documentation for the wound began 3 days after the event.
You may sit down. We will now have a 30-minute recess while the jury reviews the case. After reviewing the evidence of this case, there is no documentation that any interventions were performed, nor were any attempts to reach the physician during the first day the ulcer was seen. Therefore, this court finds the RN guilty of negligence.